In the late 20th century, the United States faced one of its most devastating public health crises, the opioid epidemic. Unlike earlier drug waves, this one didn't start on the streets. It began inside hospitals, pharmacies, and doctors' offices. The story of opioids is not just about drugs. It's about trust, profit, and the cost of misplaced faith in science and corporations. In the 1990s, pharmaceutical companies introduced new painkillers that they claimed were safe. Drugs like OxyContin were marketed as revolutionary medicines for pain relief. Sales representatives convinced doctors, and advertisements reassured the public. These pills were not addictive. But behind the scenes, companies downplayed the risks, chasing billion-dollar profits. By the early 2000s, opioid prescriptions exploded. Millions of Americans, from factory workers to suburban families, were prescribed strong painkillers, often for minor injuries. Pharmacies filled bottles of pills without question, and patients trusted their doctors. Pain was being treated, but addiction was quietly spreading. Soon, cracks began to appear. Families noticed loved ones becoming dependent on medication. People who had never touched illegal drugs suddenly found themselves craving more pills. Overdoses increased, hospital visits rose, and communities started to break down. What was once a solution for pain became a silent epidemic. As authorities began to tighten prescription rules, many patients were cut off from legal opioids. But addiction doesn't stop with a prescription pad. People turned to illegal alternatives, heroin and fentanyl. These drugs were cheaper, stronger, and deadlier. Overnight, quiet suburbs saw the rise of a crisis once thought to belong only to big cities. By 2017, the US government declared the opioid crisis a national public health emergency. Efforts began to shift toward education, rehabilitation, and accountability. Lawsuits were filed against pharmaceutical companies, accusing them of fueling the epidemic. Billions of dollars in settlements were promised to help communities rebuild, but the damage had already been done. The numbers are staggering. Since the late 1990s, more than 500,000 Americans have died from opioid overdoses. Families have been shattered, children orphaned, and towns devastated. Behind every statistic is a face, a family, a story of loss. Unlike previous drug epidemics, this one touched every race, class, and neighborhood in America. The opioid epidemic revealed the dangers of unchecked corporate power, the flaws in healthcare, and the consequences of ignoring early warning signs. It also exposed how addiction is not just a criminal issue, but a public health crisis that needs compassion, treatment, and prevention. Today, the fight against opioids continues. While progress has been made, fentanyl and other synthetic drugs still threaten communities. The opioid crisis remains one of America's darkest chapters, a reminder of how easily trust can be broken and how high the cost can be when profit outweighs people. This was episode 5 of the War on Drugs series, The Opioid Crisis in America.